core event of the day. I've got 3 guest speakers waiting for us to talk about their own areas of expertise. The first guest speakers on my list, I have Dr. Anju Pandey. She's an honorary associate lecturer at Macquarie University. She's here to talk about menopause and related women issues. Please welcome Dr. Anju Pandey.
Thank you. Good afternoon, everyone. I am Anju Pandey. I'm a GP with special interest in women's health. So thank you, NRNA team and Nari Nikunja team, for having me here to talk about menopause and middle-aged women, what we go through. Okay? So let's have a talk about women. So as we all, talked about it, what we go through, let's have a look at this lady. So look at her, she's trying to go forward and she's been almost locked with these symptoms of menopause and what she's going through. So we all probably think she will need help, I guess, isn't it? So let's have a look at the next slide. So I just want to talk about menopause today, just a bit of awareness about what happens when we go through this phase in our life. I mean, we all know a bit, and when to get help, and what are the treatments available, where we can get that help from. So basically, we say menopause after we stop having our period for about a year. It has to be 12 months, okay? And any time before that is actually not menopause. So why does that happen? Well, it happens naturally as we get older, okay? And otherwise, sometimes it can happen from, when we have treatments, some people have health issues, they might have chemo or radiation, or for various reasons, they might have to get their ovaries out. So there are different reasons. And sometimes there's actually no reason and it just happens. It can happen in very younger age. So look at this lady. I mean, she's got so many symptoms. I mean, it can be from anything, but the list goes on, and I'll just highlight a few of the common ones. So the most common thing we go through is irregular periods, so which could be, heavy periods, which could be, frequent or prolonged periods. And the other symptoms we go through is hot flushes, night sweats. That could keep us awake through the night, and that's not very nice to go through. That obviously affects our sleep. We can have joint pain, muscle aches and pains, mental health issues, our cognition can be affected, there could be vaginal dryness, interest in sex, and weight gain is another symptom of that too. So the symptom can be more than this as well, okay? So other concerns as we go through that phase of our life is our cardiovascular risk. That happens at the same time. There could be weight gain, as I've said, obesity, diabetes, our bone health, where we start losing our bone mass, that makes our bone brittle. So just talking about these are the symptoms we go through. So, I just wanted to also highlight one more important thing. There's a condition called premature menopause, which happens before the age of 40. So for some reason, as I said, your ovaries stop functioning and then you go through menopause. It's very important these people get help early because they are at very high risk. So anyone under 40 going through menopause, please go and see a GP, get the test done, make sure you get diagnosed early, and make sure you get the treatment early too. All right, so what do I do in my practice? So when I see, women, ladies coming through with these symptoms, I obviously, they tell me what's going on, I ask them symptoms, we talk about other risk factors, we talk about their bone health, and we also talk about what's her expectation, what is she trying to do? And also talk about how severe are these symptoms? How much is that affecting her functioning in everyday life? And so we have that chat, and then we set up, planning and what we do after that. So at the same time, we talk about breast mammogram, bowel screening, cervical cancer screening, and bone density testing. Same time, obviously, look, as I said, the menopause symptoms can, can be confused with other symptoms for other conditions too. So we as a GP need to make sure there's nothing else also going on at the same time. So obviously, what do we do for menopause? Say, for example, we've got a lady, she's going through menopause, all the symptoms, it's really affecting her life, she's not able to sleep, she's not able to function properly. then we go through treatment options. So the options are, we call HRT or MRT, which is the menopause replacement therapy. And these are the hormonal treatments, and there are some non-hormonal treatments too, and some herbal and complementary therapy. But look, the main thing I would like to talk about today briefly is also, and obviously there's one thing I missed, which is the understanding and support from partner. That's really important, you know, because we as women are going through a lot. So we need their support. So in terms of treatment, as I've said, it all depends again which way we go, if someone has uterus or not, someone doesn't have uterus, there are hormonal treatments. So we go through all these details, which I won't go in detail here. There's some concerns about the risk of HRT, but those concerns are very minimal. We've done a lot of research, and there's evidence that HRT works really well and it's very safe. So if you need it, please go and talk to your GP, and that can help you. Just about other non-hormonal treatments. So for some reason, some patients might not be able to get hormonal treatment. So for example, someone has got breast cancer. They can't have hormonal treatment. So there are other alternatives they can go through. So we can talk about all of these things. So basically, there's help available. We just need to go and see a GP and talk about it. I just wanted to touch briefly about this complementary and herbal therapies. Just wanted to let everyone know there's not a lot of evidence behind it. It's definitely not as effective as hormone therapy. And some of those have very limited data, and some can be quite risky with side effects. So please make sure you do talk to your GP before you start these things. All right, so as I said, when we go through menopause, we would like to talk about how we age healthily, What are the things we can do as we go through? So healthy diet, healthy weight range, physical exercise, stopping smoking, and alcohol, moderate amount of consumption, and trying to help with your sleep. So different type of things you can do, yoga, meditation, there are different type of exercises you can do. Keep yourself cool by, wearing different type of dress, keeping your room cool and all of that. So there's, again, some mixed evidence about whether all these symptoms will help with the hot flushes and night sweat symptoms. Weight loss definitely does seem to have that positive effect. It does improve those symptoms. The other things, some of them doesn't really help, okay? Yoga has a mixed evidence. It's a good thing to do. Overall, it helps with well-being and general health and physical and mental health. So in terms of activities, we talk about, any physical activities should be something that should increase your heart rate and breathing rate. So we need at least 2.5 hours of moderate intensity exercise, which means brisk walking or swimming or dancing. I've also put cleaning windows and things, which I don't think we'll be doing, but that's all right. Also, you can do a bit more intense 1.5 hour of exercise in a week. So if we could try to fit that in our crazy, busy life, then I think that will definitely help us a lot as well. So we talk about weight-bearing exercises. That's really important for our bone health. So I would suggest 2 to 3 days per week. Let's work on those exercises too. So what I've done is some of the tables have got this, there's a symptom score sheet. So women who are going through menopause or anyone over 40, 45, if you'd like to fill out that form and see where you are, we can do that. If you'd like to ask any questions end of the session, you can let me know. All right, so if we do all of these, I think we'll have a happy woman, willing to do anything, who's not scared of anything. All right, thank you so much. Please feel free to ask me questions at the end of the session.
Thank you, Dr. Anju Pandey. That was very engaging and informative presentations.